Today I am going to teach you about dentigerous cyst. Dentigerous cyst can be defined as an odontogenic cyst that surrounds the crown of an impacted tooth caused by fluid accumulation between the reduced enamel epithelium and the enamel surface, resulting in a cyst in which the crown is located within the lumen. It is called as the odontogenic cyst because it is derived from the tissue forming the oral cavity, and it surrounds the crown of an impacted tooth. Impacted tooth is a tooth that has lost the ability and capacity to come into the oral cavity and caused by the fluid accumulation between the reduced enamel epithelium and the enamel surface. So, the fluid gets accumulated between the reduced enamel epithelium and the crown of the tooth. Reduced enamel epithelium is the epithelium that has formed during the development of the enamel, and now it is also present. It should have disappeared with the formation of the tooth, but it has not disappeared because it is showing some pathology called the dentigerous cyst. So the crown is present within the lumen. It is one of the most common type of developmental odontogenic cyst. It is called as developmental type because it is formed during the development of the oral cavity, and it is called as odontogenic because it is formed from the tissue that helps in the formation of oral cavity. It is associated with permanent tooth and seldom associated with deciduous tooth. Now the clinical features of the dentigerous cyst. It is associated with impacted or unerupted tooth. Impacted tooth is a tooth that has lost the capacity to come into the oral cavity, while unerupted tooth has some tendency to come into the oral cavity in some times. And the most common site are maxillary and mandibular third molar region. Most commonly the mandibular third molar region and the maxillary cuspid areas. It shows male predilection, and it causes the expansion of the bone and facial asymmetry, and it also causes extreme displacement of tooth and severe root resorption of adjacent tooth, and it is also painful in advanced cases. Now, in dentigerous cyst, we will learn about radiographic features of the dentigerous cyst. There are three most common types of radiographic features, that is the central, lateral and the circumferential type. In central type, the reduced enamel epithelium is present centrally to the crown of the impacted tooth, and in the lateral type, the reduced enamel epithelium covers the lateral portion of the crown, and in the circumferential type, it surrounds the tooth circumferentially. And in all the three types, the reduced enamel epithelium is attached to the neck of the tooth, that is the cemento-enamel junction. It is always present at the neck of the tooth. Now about the histological features of the dentigerous cyst. Dentigerous cyst consists of a lining epithelium that is only 2 to 3 layers thick cells, and it doesn't contain any keratinization and any retipex, and it also contains the connective tissue capsule. It is the cystic lumen. It is surrounded by the reduced enamel epithelium that is only 2 to 3 cell layers thick, and it also surrounds the connective tissue capsule that contains the epithelium tissue also. Now about the treatment of the dentigerous cyst. When the cyst is small, it is removed surgically by enucleation process. enucleation process, and once the cyst is of large size, it is removed by the process of marsupialization. And the potential complications of dentigerous cysts are ameloblastoma, epidermoid carcinoma, and the mucoepidermoid carcinoma.